about the gene and the cell therapy. How does it cause? We're also gonna learn here if is it risky or is it beneficial to the health of the people, especially for the disease. So also we're gonna learn how much does it cost or how long does it affect and what's the effect for the future generation. So let's go!
What are gene therapy and cell therapy? Gene therapy is a type of medical treatment that involves the introduction, alteration, or removal of genetic material in an individual's cells. It aims to correct genetic mutation, replace missing or defective genes, or modulate gene expression to treat or prevent diseases. Gene therapy can be used to treat genetic disorders, inherited diseases, and certain types of cancer by targeting the underlying genetic causes. There are different approaches to gene therapy, including inserting functional genes, editing genes to correct mutation, or using gene silencing techniques to regulate gene expression. Gene therapy holds promise for personal medicine, offering potential courses or long-term treatment for a wide range of conditions by targeting the root genetic causes. Cell therapy is a type of medical treatment that involves the transplantation or manipulation of cells to restore and enhance the function of damaged tissues or organs. It harnesses the regenerative and reparative properties of cells, including stem cells, to promote healing and regeneration in the body. Different types of cell therapy include stem cell therapy, immune cell therapy, and tissue engineering, each tailored to target specific health challenges. Cell therapy offers potential solutions for personalized medicine, providing individualized treatments based on patient unique cellular makeup and medical needs. How does gene therapy work? Gene therapy aims to treat or prevent genetic disorder by introducing corrective genes into a patient's cells. Gene therapy can be performed ex vivo outside the body by modifying cells in the lab setting before reinfusing them into the patient, or vivo inside the body by directly administering the gene therapy to the patient. The ultimate goal of gene therapy is to replace faulty genes, regulate gene expression, or introduce new function to cells, offering potential causes or treatments for genetic diseases. What are the strategies being used in gene therapy? Presently, there are numbers of strategies that are mainly used in somatic cells, such as gene addition. Gene addition is a process of introducing a functional copy of a gene into an individual cells to supplement or replace a faulty or missing gene. Gene correction. Gene correction is a process of repairing a mutated or faulty gene in an individual's DNA to restore its normal function. Gene silencing. Gene silencing is a process in which expression of a specific gene is reduced or completely inhibited. Reprogramming. Reprogramming is a process of changing the identity or function of a cell by resetting its gene expression patterns. Lastly, cell elimination. Cell elimination refers to a process of programmed cell death, also known as apoptosis, in which cells are selectively eliminated to maintain tissue's homeostasis.
What is the future of gene and cell therapies? The future of gene and cell therapies holds great potential for transforming the treatment of genetic disorders and other diseases, offering personalized and targeted therapies for patients. Risks associated with gene therapy: immune system reaction to the introduced gene, overactive immune response leading to inflammation or toxicity, insertional mutagenesis, off-target effects, development of cancer or other adverse effects. How do you classify gene therapy? Riskier or more beneficial? Gene therapy is a complex medical intervention with both potential benefits and risks. While it holds promise for treating genetic disorders and improving patient outcomes, it also possesses risks such as immune reactions and long-term effects that require careful consideration.
What are the uses of gene therapy? Replace missing or defective genes, deliver genes that speed up the destruction of cancer cells, supply genes that cause cancer cells to revert back to normal cells, deliver bacterial or viral genes as a form of vaccination, provide genes that promote or impede the growth of new tissue, and deliver genes that stimulate the healing of damaged cells. The overall aim of gene therapy is to use genetic interventions to treat or prevent disease.
What are the common types of cell therapy? Common types of cell therapy includes stem cell therapy, which involves using stem cells to repair damaged tissues, T-cell therapy, where patients' T cells are modified and infused to enhance immune responses, mesenchymal stem cell therapy for tissue repair and immunomodulation, natural killer cell therapy for targeting abnormal cells like cancer, and platelet-rich plasma therapy for promoting healing and tissue regeneration through concentrated platelets. Should people be allowed to use gene therapy to enhance basic human traits such as height, intelligence, skin color, or even athletic abilities? The ethical implication of using gene therapy for enhancing basic human traits raise concerns about equity, consent, and potential societal implications. Any decision to allow such enhancement should involve thorough ethical considerations, transparent discussions, and regulatory oversight to ensure responsible and equitable use of this technology. If gene therapy delivers a cure, how much is that cure worth? The value of a gene therapy cure is invaluable as it can provide life-changing benefits, improve quality of life, and potentially eliminate the need for ongoing medical treatments. However, determining a monetary value for such a cure should consider factors such as the cost of development, accessibility to all populations, and ethical considerations to ensure fair and equitable distribution.